You're welcome to the Moon Managing Performance and Reward Management in Healthcare Setting. So our focus is going to be on the performance of the doctors, the midwives, the nurses, and the other healthcare professionals. So we're also going to talk about the performance of the support staff, the administrators, the logistics department, the askaris, the books, etc. But our major focus is on the performance of the doctors, the nurses, the midwives, and the lab technicians, etc. So it's very important for an organization, especially the hospital or the healthcare organization, to make sure that the performance of their employees are managed so that the outcome, which is the overall performance of the organization, can be excellent. So when talk of the overall performance of the organization, we are measuring it in terms of the number of patients who have recovered. So if the patients in the hospital are not recovering, the patients are dying, it means the doctors are not performing. So when the doctors are not performing, it means the entire organization or the hospital itself is underperforming. So it's very important for you as a healthcare admin to know what you need to do in order to improve the performance of your doctors, the performance of the nurses, etc. Now let us look at the overview of the module. So the performance and reward management in healthcare is crucial for optimizing workforce productivity, ensuring quality patient care, and retaining talented professionals in the industry. It encompasses strategies aimed at enhancing employee performance and motivation through effective reward systems. So that's the overview of the module we are looking at now. So having looked at the overview, I want us now to focus on the definition of performance management and development. So here we are focusing on two keywords, the performance management, and then later on we shall also look at the development aspect of it. But for now, let us look at what performance management is all about. So it's a systematic process of managing employees. We are talking about basically the doctors, the midwives, etc., or what you can call the health professionals to achieve organizational goals. What is the goal of the organization or the hospital? Actually, to make sure that patients are recovering, to increase the recovery rate of the organization, or when the patients are admitted, to make sure that the death rate is minimized. That's what we call the objective of the healthcare organization. So it involves setting clear objectives, providing feedback, and evaluating the performance to drive continuous improvement. So basically, that's about the performance management. You need to set objectives. You need to set targets to be achieved by the doctors. If you don't have the target in place, then there's no element of management. How are you going to assess the performance of the doctors if there are no objectives set, if there are no targets set? So it's very important as healthcare admin to make sure that you always set clear objectives or targets to be achieved by your employees, and also they need to give you feedback on how they have done the task. If there are any challenges, you need to find a way of addressing some of these challenges. So that's the definition of managing performance. So having looked at that, now let us look at the next word, which is the reward management. So the reward management is basically strategies and policies that aim to reward employees fairly, equitably, and consistently for their contributions to organizational success. So reward can be monetary or it can also be non-monetary. So by monetary rewards, we are talking about the salaries, or we can talk about the bonuses, commission given to the employees as a means of compensating them for the work they have done. So these salaries will be fairly. It means you don't need to pay people based on their, let me say, religion background. You are favoring certain religion over others or certain religion over others. That's not good in the context of managing human resource in an organization. So basically, it's about the word management. So now let us look at the significance of performance management in healthcare. How is it important? Number one is that it enhances patient care. When we talk of hospital, we're basically talking about the patients who are sick or the sick people. When they come to the hospital or to the facility, they need the care. And the care is given to them by the trained medical professional. So the advantage of this module is to make sure that the care the patients are receiving is of quality. Otherwise, if you do not manage the performance of these people, they are going to give poor service to the patients. And dealing with the patients is very, very critical because they are fighting lives and death. If the person managing them is not having the knowledge, the skills needed, the person is going to die. So it's not like business whereby you can gamble. In healthcare setting, in hospital setting, you don't gamble. It is the reality. So make sure that your employees, the people who directly interact with the patient, they have the relevant skills and they need to manage those skills. Otherwise, if you don't manage the skills, they will not be having the latest knowledge on how to deal with the patient. The next important is retention of talent. When we talk of retention of talent, we're talking about maintaining the people who are doing their best for the organization, the doctors, the nurses, the midwives, okay, the lab technician, those who are performing to make sure that the patients are recovering. We need to retain them. That's the significance of this module. It is through the management of their performance that we understand the areas of weaknesses where we need to improve them. And once those areas are improved, it means you're going to retain them. And by the way, if someone is motivated, it means the person is going to remain in the organization. So by doing that, you are retaining the most talented employees of the organization. So we are still continuing with the significance of management performance. The next one is operational efficiency. So by aligning individual goals with organizational objectives, performance management drives efficiency and innovation within healthcare processes and services. So in terms of operational, we mean the daily activity done by the health professionals. What do they do? So they become an expert in that, diagnosing the patient's prescription of medicine, discharging, monitoring the sick person. So these are some of the operational activities they do. So this movie helps you as an admin to make sure that the operation is very effective. So these are some of the significances of managing employees' performance in an organization. So having looked at the significance of managing performance, now let us look at the scope of performance management in healthcare setting. One is the individual performance. You look at one doctor or one nurse, then manage his or her performance. So under individual performance, you need to have job descriptions. The job description is basically the daily activity the doctor is doing, the daily activity the lab technician is doing, the daily activity the midwife or the nurse is doing. So you need to have it clearly so that they know what they are supposed to be doing. It is the role of the human resource to make sure that everyone in the organization has job description. And this job description can be updated. Okay, if the person has gained some training, if you need to give extra work to the person, you need to make sure that the job description is always updated because it guides the operation of the organization. It's still under individual performance, you can have what you call performance appraisal. Performance appraisal is basically assessing or evaluating the performance of individual against the set standards. So it's very important as an admin to make sure that you appraise the performance of the doctor, their interaction with the patient, their coming to workplace, the commitment level, etc. The next one is a development plans. So development plans deals with the areas of improvement. After conducting the performance appraisal, of course, you are going to identify gaps or the weaknesses. After you identify the weaknesses, the next thing is now to have a plan to address the weakness. That's what we call a development plan. As a manager or as an admin, if you have identified the weakness of a doctor or a nurse, but you don't want to improve that weakness, then you are not developing that person. At the end of the day, the organization is the one suffering. So that's about individual performance under the scope of performance management. The next scope we are going to look about is the team performance. The first one was individual. Now we are talking about the team performance. When the patient is brought in the facility, you have a number of people working on that patient. That's what we call team performance. Okay? The nurse, the lab technician is there taking the blood sample for testing. Okay? The medical doctor is there, they are prescribing the medicine, the nurse is monitoring the patient. These are what we call team performance. So under team performance, there are what we call collaboration. Collaboration is basically teamwork, working as a team to make sure that the patient is covered. Okay? You don't need to work alone as the overall doctor. You need the lab technician to test the sample, if it is a blood sample or any other thing. You need the lab technician. You need the nurse to be there in the ward with the patient. That's what we call team performance. The next one is team evaluation. Now here we assess the performance as a team, not individually. We look at the number or the rate at which patients are recovering. So we don't focus on individual, but we focus on the team as whole. How many patients were admitted and how many have been discharged successfully and have recovered. So that's how we measure the performance or the evaluation of the team. Then the last one is the rewards for the team success. The reward can be monetary in terms of money and also non-monetary in terms of just recognition, certificate of recognition. So in our context, when we hear the word reward, people always think about money, but it's not all about money. Okay, it could be promotion, it could be recognition, or it could be even a study kind of scholarship. So that's how you reward the team for the job well done. So as a manager or as an admin, you need to make sure that you always reward your team. Rewarding your team can act as a motivational tool. They'll be motivated to do more for the organization. But if you don't reward them, they feel like their efforts are not recognized by the organization. So it's your responsibility as a human resource or as an admin of that particular hospital to make sure that the doctors, the nurses, their efforts are recognized. So that's about the team performance and the scope of performance management in healthcare setting. The next one now is the compensation and the benefits. This is where we talk about salary, this is where we talk about commission, bonus, etc. So we are talking about the salary structures. So you need to design a competitive and fair salary structure based on the industry standards. What do I mean by competitive? By competitive means the person should not feel that he or she is being underpaid. No, being a doctor is not something easy. In the context of South Sudan, I think you spent about 6 to 7 years to become a doctor. But if the salary structure is not competitive, then that doctor is most likely to leave the hospital or the organization to go and look for where the salary structure is very competitive. So it has to be also fair, okay, based on the qualification. You don't need to segregate people because of maybe religion, affiliation, something like that. You need to be fairly and as a manager in terms of compensating or in terms of designing salary structure. That's about compensation and the benefit. The next one now is the recognition program. We have just talked about recognizing or rewarding the success. So recognition of the employee, you can have employee of the month. Okay? Or some organizations they have it once in a year, employee of the year. That one is very important because it motivates the underperforming employees also to do better come the next year or come the next month. So recognizing outstanding individual performance regularly motivates them. It makes the doctors, it makes the midwives or the nurses to feel that yes, my effort is appreciated. Not just that, so others will also do what? Will do their best to make sure that they are also recognized. The next one under recognition is still awards and incentives. So you need to provide bonuses, incentives for exceptional contributions. So bonuses incentives are given on top of the salary. For example, if the doctor is earning, let me say $1,000 per month, because of his or her exceptional performance, can decide to give him or her something a little bit on top of his or her salary. That one can motivate him, not only him, but can also motivate others to do better. So that's about recognition programs as a scope of reward management as far as healthcare sector is concerned. The next one now is the career development. So we talk about the training opportunities. Okay. If someone has worked for the organization for over 10 years, so the person has just remained in the same place, no promotion, that person will feel motivated. So as a manager, you need to be very cautious about that. No one should work in the organization for more than 10 years and is not being promoted. If the person is not being promoted, it means the problem is within the management. You don't offer the person the training or development skills, opportunities to upgrade. So you need to have a career development plan in place whereby you can upgrade the skills of your employees or the doctors. So when we talk of employees, I'm basically referring to the medical personnel. I'm not referring to these other employees because we are within the setting of healthcare uh, sector. So doctors need to be upgrading their skills. That means you are providing training development for them, you are providing career development for them. So tomorrow, next tomorrow, if they are to go to another organization, they will really feel the impact the organization have had on them. The next one is promotion. You can talk about career development if you don't offer promotion. Promotion is basically about giving higher responsibility to the individuals, and it comes with the increment in salary. You can't promote someone and then the person remains at the same salary scale. That means there is no element of promotion. If the person is not becoming a full doctor, make sure that you also increase the remuneration. That shows that the person has been promoted. But if you don't do that, just promotion without any kind of increment is almost uh, useless. So as an admin, you need to make sure that promotion goes with the increment in payment. So that's about career development. So now let us look at the objectives of managing performance in an organization. One is enhancing general performance of organization. Remember, the performance of an organization depends on the performance of its employees. If the employees are underperforming, it means the organization is also underperforming. So as a manager, make sure that your employees, each and every one in an organization, is doing their best. Because at the end of the year or at the end of the day, it is the organization which benefits from their performance. The next one is to motivate employees. No one will feel motivated if his or her performance is not managed, if it is not developed. So motivation is part of organizational performance. It plays a crucial role in managing the performance of organization because people will do their best. They will give whatever it takes to make sure that the organization moves on. In spite of some challenges, they will always remain loyal to the organization. So that's about motivation as an objective of managing employee performance and organization. The next objective is the retention of talent. You manage performance because you want to retain employees. Retaining employees is very important to the organization because you avoid very many costs associated with the personnel management. The cost of recruitment, the cost of even hiring a wrong person. By the way, in human resource, we have two errors. The selection errors, and then we also have the omission error. So the selection error happens when you decide to give the job to someone who's not competent enough because maybe the person had impressed you during the interview process. Okay? But in reality, the person is not competent for the job. That's what we call selection error. Then the omission error is the opposite. You let go of the most suitable candidate because he didn't do well during the interview. So this is common. So if you are not retaining employees, it means you are going to face these errors. So therefore, as an admin, make sure that employee retention is on top of your agenda. The next one is the continuous improvement. Once you appraise someone's performance, of course, you always identify gaps or what we call the weaknesses. And what happens if the weaknesses have been identified? Of course, you need to act upon, you need to work on them to make sure that those weaknesses are rectified. By doing that, the employee's performance is improving. So that's about the objective of managing performance. So having looked at that, now let us focus on challenges of performance management. Number one challenge is about the subjectivity in performance evaluation. So when we talk about subjectivity, we're talking about personal issues or bias. Okay? You have problem with the someone in the organization, instead of appraising that person professionally, you decide to bring in family issues because you hate him or you hate her, you start under appraising that person. That one affects the overall process of the appraisal. So what is the impact? The impact is that it can lead to demotivation, decrease morale, and challenges in building a performance-oriented culture. Okay? Because if I notice that you have under appraised me, you underscore me because of our personal issues with you, of course I will not be motivated in that organization because I know that the results are not mine. Just because you have issues with me, you decide to underscore. But I want to tell you that in a professional setting, do not bring family issues or personal issues when it comes to evaluation because we are basically focusing on the work. Evaluation is work related, it's not something outside the work. Anything outside the work should not be included in our evaluation process. So basically that's about subjectivity in performance evaluation. The next one is balancing quantity and equality. So when we talk of quantity, we're talking about now the number. Okay, most people want quantity instead of quality. So organization may focus on quantitative performance metrics at the expense of qualitative aspects, impacting the overall quality of the work. Okay? You need to have more doctors in the hospital, but what quality do they have in an organization? You may have doctors who do not have the qualities. They don't have the qualification, but they are there. 10, 11 of them they are there without qualification. Then some organization can have only 2 or 3, but with the quality. So as an organization, it's better to balance between the quantity and the quality. Of course, I'm not saying that you don't need to have numbers. You need to have numbers, but at least you should also consider the quality of the number you have had in an organization. That's the challenge. So what is the impact here? The impact is that it may lead to compromised service quality in a sector like healthcare. I told you from the beginning that healthcare is a very delicate sector. We are dealing with life. If you are recruiting doctors who are not competent, doctors who are not qualified, you are going to kill someone's life, yet the person doesn't deserve to die at the moment. So the impact is really huge in terms of life. You're going to be losing lives because of your negligence, because of you recruiting people or doctors who are not qualified. So these are some of the challenges related to balancing quantity and quality. So my advice here is you need to be cautious about the number and then the qualification of the doctors, the nurses, the midwives you are planning to recruit in the organization or in the hospital. We still continue with the challenges of performance management. The next one is budget constraint in the reward management. So how is it a challenge? Organizations may face limitation in budget allocation for rewards, impacting the ability to offer competitive compensation. So doctors are the most high paid professionals. Okay? If you have more than 10 doctors who are earning about, let me say, $2,000, okay, that's a lot of money. Because every month the organization will be losing how much? $20,000. So the question now is, does the organization have that resources, the budget to cater for the 10 doctors? That's only doctors. How about the nurses? How about lab technicians and other support staff? So it becomes very challenging when we talk about budget in reward management. So as an organization, we need to also look at that. Okay, we need to look at that. What's the impact of budget constraint now on performance management? The impact is the difficulty in attracting and retaining top talent due to financial constraints. Okay. Whenever you advertise, people will not be willing to apply because they know the organization is not paying well. Okay? So the current trend in the job market is that people are yearning to work with international NGOs and the UN agencies because that's where the money is. So when you see adverts from the UN agencies or the international organizations, people are running there. But if it's the local NGOs and other companies, people are reluctant. Why? Because of the budget, because of the payment. They know that if I go with the local NGOs or the government teams are not being paid like the UN agencies. So that is the impact in on the organization or the hospital. As a manager, you need to find a strategy of how to at least have a competitive pay the, the, the staff. That can only happen by maybe reducing the number of the staff. If you don't have enough budget, reduce the number of the staff to make sure that the few you are having at least paid well. And when they are paid well, they will do their best to make sure that they offer the best services to the patients. So that's about budget constraint as far as reward management is concerned. And the next one is increased demands for personalization. We're looking at the challenge. Employees increasingly seek for personalized rewards requiring organization to tailor benefits to individual preferences. That means that what motivates me will not be the same as what motivates you. So if you give me what I already have, there's no element of motivation. So I need to get something which I don't have. That will be motivating. That's what I mean by personalization of rewards. So what is the impact? The impact in an organization is that making diverse employee needs while maintaining consistency for the challenge in reward management. Because you don't know what other employees will be demanding for. So that one becomes a very big problem in the organization and affects the way the organization maintain its uh, reward process. So lastly, we're going to look at the trends in performance management and development. Number one is the outcome-based performance. So when talk of outcome-based performance, people are now, most organizations are now focusing on the performance or the results the organization is getting. In the hospital, we're talking about the rate of recovery. If the rate of recovery is high, then the organization is based on that to pay employees. So it's all about performance. The next one is a personalized rewards. I've just talked about personalized rewards. That whatever motivates me will not be the same as whatever motivates you. So we have different things which motivates us. If you give me what I have, I will not be motivated. But if you give me what I do not have, I will be motivated. That's the personalized rewards as a current trend. Then the last one is wellness program. So you need to introduce wellness initiative as part of the reward system to promote employee healthy and well-being. Okay, you can have initiatives like lunch at work, breakfast, the restroom, etc. All that is part of wellness initiative. All is aimed at making sure that the employee is comfortable at the organization. They are doing their best to the organization as a part of trying to retain them for the organization. So basically, that is what I have for you in this presentation. I want to say thank you so much for your time. I will meet you in the next session.